because the kidneys are connected with gonads. So you should not abuse them. Then comes sudden reversible loss of renal function, which develops for a period of days or weeks. You may say, sir, suddenly 2-3 days back it is sorted. No. The malfunction would have started long back. You would not have noticed them. You would not have noticed them properly. All right. What has come? What are the things we have to do? Then there are many things that one has to be, chiefly oliguria or anuria, sudden increase in metabolic activities, waste products, including urea and creatinine in the blood, with the consequent development of uremia, acute tubular necrosis, pyelonephrosis, nephritis, post-renal causes. It usually indicates obstructive uropathy below the urinary bladder. So not only that kidneys are affected, the urinary bladder, the urinary ducts, everything has been affected because they could not excrete the unnecessary things. I have been already telling you, the body has to eliminate the waste products time and again. Unless it doesn't, so the functional activities are deranged. Then the clinical features depend upon major pattern usually seen as syndrome or acute nephritis. This type is mainly associated with acute streptococcal glomerular nephritis. See, streptococcal is a fungus infection, virus infection. Then comes glomerulonephritis because the nephrons are damaged, those functions are deranged, and then the RPGN, it is called in short. The features are mild hematurian, oedematic, and mildly hypertension. First, blood comes out, drops. Then edema, swelling will be there. Then it leads to hypertension. So these are all the things that one will develop, and slowly it becomes acute renal failure. There are two things, chronic renal failure and acute renal failure. Progressive, irreversible deterioration of renal function. See, if the urinary problem starts, we have been all advised, you see what are the symptoms. Is it showing problems at the end of the penis, or the urine is causing heat and irritation while passing throughout the penis and urethra. Urethra we can't feel, but you can see it's in pain in the penis. Then comes the slow destruction of renal functioning, eventually terminating to death, and sufficient numbers of nephrons have been damaged by that time. Yes, major problem is acidosis, azotemia, clinical uremia syndrome. What is acetones? And acetomia means accumulation of urea in the blood. Then comes parenchyma and decreased renal reserve. So hyperuremia or high level acids in the blood. Hyperkalemia, higher than the normal concern treatment of potassium in the blood. Acidosis, a condition in which retention of the alkaline acidity in the blood is very delicately balanced. So that is why we go for clinical test. Why homeopath also should know is the reason. Then urochromia, coloring of matter in the urea. Rapidly progressive glomerulonephritis. What is glomerulus? A tuft of capillaries which is vaginatis, the kidney tubule and its convenient commencement of the renal cortex. What is cortex? The external layer of organ. Every delicate organs are protected with cortex or layers. That itself indicates that your organs are in the normal condition. In a CT scan or MRI scan, it is properly revealed which of the things are damaged. Acute nephritis means streptococcal infection in which there is an inflammation of glomerulonephritis of the kidney. So these are all the damages that could happen to the organ. Whatever technicalities you call it, it's all right. But damage is one and the same, slowly or either chronically or acutely. Homeopathic in renal failure. The symptoms are considered as the body's natural reaction, the illness, and help in find the remedy against the illness. Yes, this is generally different versions, similar, similibus, currenter. Homeopathy works wonderfully in the management of different pathological conditions like renal failure, including renal failure. Different pathological conditions, whether heart tissues are damaged, whether eye tissues are damaged, whether stomach tissues are damaged, whether rectum has damage, which is called the pathological condition, causing disturbance in the normal functional activities. Then, homeopathy in different pathological conditions works on principles of similia, similibus, currenter. That is, in the, yes, he has given other many things. I will go to the symptoms of the homeopathic medicines, other things. Some important homeopathic medicines are in the CRF. What is CRF? Chronic renal failure. Chronic renal failure. Verse. Frequent desire to urinate with tenesmus. Urine white, scanty, bloody, copious, turbid and petit. Sir, how many expressions, sir? This may be expressed by different people in a different language. So all these things come together. Urine white, scanty, bloody, with scanty or with or without bloody, and turbid and fatigue. Involuntary urination towards the morning. When you get up, involuntarily you pass urine. What is the medicine for that? Ammonium carbonicum. Ammonium carbonicum. Then white oxides of arsenicum. Urine is scanty, burning, involuntary. Bladder as if paralyzed. Albuminuria, nephritis, uremia, atony of bladder in old person. That is shrinking in the old person. Arsenicum album. Epithelial cells, cylindrical clots of fibrin and globulus and pus are in the blood. See, the kidneys are provided with tubular cells. You know, epithelial cells, normal cells, and different types of cells in the body. Stomach cells are different, and the rectum cells are different, and cells in the large intestine and small intestine are different. They are all called ciliary cells, epithelial cells. Like that, according to the place, they change themselves and function themselves. So epithelial cells, cylindrical clots, or fibrin and globules of pus and blood. Feeling of weakness after urination. Retention of urine. That is, you won't pass completely urine. You will pass and then wait for some time, again urine comes in. As the bladders are paralyzed. Sometimes woman gets this after the childbirth. Woman after the childbirth may get this problem. Yes. Aurum metallicum. A painful retention of urine with urgent inclination to make water and pressure on the bladder. Frequent emission of watery urine. Urine turbid like buttermilk with thick mucus like sediment. That is why we go for urine culture. It will clearly give us about the status of the urine and kidneys, where it is failed. So aurum metallicum comes. Aurelia hispida. It is a valuable diuretic, useful in dropsy, caused by renal or hepatic diseases with constipation. Diuretic, absence of urine or slowly dripping urine, etc. etc. It is connected to three things: caused by renal, hepatic, as well as constipation. What is the medicine? Aurelia hispidia. Then Cantharis vesicatoria, nephritis with bloody urine, intolerable tenesmus, cutting before, during and after urine. Urine is like shreddy with constant desire to pass urine. Jelly like urine, etc. Then seminum sulfuricum, symptom of interstitial nephritis predominate. Urine is bloody, turbid, slimy, clay colored, having greasy sediment. Small amount of urea and phosphoric acid with excessive uric acid. Chlorides are present in the urine, etc. So everything is revealed by your clinical test. Eucalyptus globulus, acute nephritis, complicated with influenza. Urine contains pus, deficit in urea, bladder feels loss of expulsive force, then there is a great burning in the tenus pus, that is in the bladder urine. And then comes cicuta virosa, frequent micturition, passing urine, dribble and now and then. The urine is propelled with great force and retention of urine. In spite of that, urine is retained. Again you feel like passing urine, etc. etc. Convulsions with violent distortion of the body. Distortion of the body means you feel the entire body is disturbed, uneasiness, etc. etc. Then cuprum metallicum. There is a suppression of urine. Patient passes clear watery urine during or after spasms. Urgent desire to urinate with a scanty emission. You feel like passing urine, but when you go there, you pass only scanty. So these are all the things where the patient cannot understand. Only the physician has to understand. Burning, shooting in urethra like cantharis. Cuprum arsenicum, uremic convulsions, kidney inefficiency and uremia, garlic odor of urine, the smell. When you take more garlic stuff, that also you get as urine. You can feel that garlic odor in the toilet. But in the normal circumstances, if this smell comes in, you have to think of it, of cuprum arsenicum, garlic odor of urine of high specific gravity, increased acidity. That is why all these things has to be proved by clinical test. Urine suppressed digitalis purpurae, then turbid, burning, etc. etc. L serum. L serum means a serum prepared from L fish. L fish. The important symptoms of triology includes hypertension, oliguria without edema. It is eminently efficacious to reablate the diuresis and in rapidly arresting albuminuria, etc. etc. Then comes the glonoinum, increased secretion, pale urine, must pass large quantities of albumin in urine, etc. Morphinium, slow and difficult urination. Opium is a very good remedy. Opium, scanty, deep colored, generally you can give it. When some trouble starts, you can start with opium, 1 or 2 doses. With a sediment like brick dust, retention of urine with insomnia, intermittent respiration. Phosphorus is also a very good remedy. Urine, turbid, brown, red sediment, hematuria, these are all within our reach. We need not go deep into the analysis, whereas in the case of opium and phosphorus, we can easily decide the matter. Okay. Then other medicines are there, terbinthina. Then there is a medicine called urea, hydrogogue, diuretic, treatment of dropsy, renal dropsy. It is called the Gujarati treatment, taking the urine as a medicine, one's own urine as a medicine. Uranium nitricum, this is connected with diabetic, a good remedy for diabetic nephropathy. Then comes uva ursi, painful micturition with burning sensation, slight passes off with bright keynote of indication. Then the miasmatic condition also has to be concluded. Miasmatic condition has also taken into account. Here, the author has given few lines where you have to consider. One, I will come to this. Here, a patient has come to the homeopathic physician. Then he was treated by allopaths. Then he could not express how he has been feeling. Though in spite of complete treatment, the patient has not become normal. Then what happened? The physician, homeopathic physician, has gone into the case study. He has seen the following thing. For 5 months, with medication, no improvement, till July 2019. After that, she started homeopathic treatment. She followed homeopathic medicine as prescribed. First, carcinosinum, then ammonium gummi, and finally sulfur. Considering the individualization, the patient improves symptomatically and changes were also seen in the laboratory parameters, where serum and creatinine has become 2.6 less than the required 4 milligrams, etc. Then hemoglobin 11.9, it has increased from 7% to 11%. Then other things like BVAP and GFR, all these things have improved her condition. Why I am telling this? You have to hit the jackpot. Just like a shooter, you have to shoot it. Before shooting, what you must do? You have to consider all the aspects into and take everything into consideration. That is why systematically we are going to all these things. You should not suddenly say, yes, doctor has said, Murthy sir has said, Berberis vulgaris, give Berberis vulgaris. Yes, Berberis vulgaris can be given. It is not going to cause any damage, any problem. Cantharis, it is not going to cause any damage. You can take Cantharis daily 1 or 2 doses. Nothing will happen to the organ. Whereas, it will not completely cure. How many days will take Berberis vulgaris? Sabal Sarluta, clinical test says stones in the, so you go for Sabal Sarluta. That will give you relief. Then what you have to do simultaneously? Why this sediment of stones in the kidney? Because there is a problem in the digestion that is not properly made to eliminate them. So it is accumulated. So lycopodium, pulsatilla, carbovate will come in from. This is simple treatment. Whereas in chronic acute renal failure, you have to be very, very careful. You have to go through all the fundamentals. All the fundamentals. You must see the clinical test. You must also see the medicine that you give doesn't increase the clinical parameters that's already there, that doesn't worsen them. This is the knowledge that we give. That is why we repeatedly give all this information to you time and again. You can boldly treat acute kidney. One thing I tell you, there was a problem in one person. He feels more frequent urination in the night. He says while passing urine in the night, he feels irritation, pain at the end, and ulcerative feeling. So we started it with Berber's vulgaris. After seeing the report, there is no stones, then we are given Cantaris. All right. Will that suffice? You stop the medicine, again it will reoccur. So you must see the clinical tests where there is accumulation of cells in the glands, accumulation of fluids in the glands, and is he diabetic? Is he feels insomnia, sleepless things? What is the cause worrying him? All these aspects into consideration. Then I suggested diagonal SBN drops, and I suggested the Sabal Charulta, Cantaris, etc. etc. Slowly, he has recovered all those things, problems. So, that indicates how you, unless you are possessed with full knowledge, when patient reveals the symptoms, the medicine should run your mind. And you must eliminate what should be taken, what should be not taken, what should be suggested to the people. Don't suddenly jump to the conclusion in cases like heart problems or diabetic conditions, the digestion problems. You give palliative in the first week. See how things are there. Then next week you go to the background. Is there any miasmatic condition? Psoas hypocytic tuberculosis. If no other things are there, then you go for the specifics. Then you can correct the, but in all these things I tell you, it will take some time. Allopaths may give their medicine. You may feel normal in overnight, 5 days, 10 days. But you stop the medicine, what happens? You go to doctor, you have to take it continuously. What side effects it can give? Mere vitamins, one person has been taking for years together. It has produced skin problems. I am not threatening. I am not threatening. I am giving you the clue. Unless, though allopath may suggest, you regulate their medicine in an emergency condition. Then you slowly substitute your homeopathic medicine. You will feel completely out within a due course. It may take 5 months, 6 months, 8 months, etc. In a chronic condition, it may take even 6 to 8 months. No problem. But he is completely cured. So, even the critical conditions where acute renal failure is there, where you have to go for dialysis. When once dialysis is done, it is very difficult for us to give our medicine and regulate them. But you can try, nothing wrong, nothing wrong. Why? Because the dialysis process damages the tissues here and there. So you can judiciously apply all the medicine and then cure the patient to the extent possible. Slowly, the urine condition will improve. Thank you very much for the patient hearing. Thank you very much. I have given you one chart that has been circulated. I will take up this chart in the next class. You go through all the medicine. The chart is very beautifully grafted. Elimination and taking the medicines there. I will go by one and try to enlighten you the maximum possible. Hereafter, if a patient comes to you, flu, fever, cold, cough, you must be able to tackle them very easily. Within 2 to 3 days, within 2 to 3 doses, he will feel alright. Within 2 days, he will be completely alright. I know many cases where the allopathic drugs, antibiotics are given. What they cause? They give relief only till medicines are there. Again, this other problem comes. That is how this mutation of the disease takes place. COVID variant, COVID mutations. And now they say, when once you are affected with COVID, lifelong you have to suffer. It's a threat. Our one medicine, arsenicum organ, answers all these questions. Thank you very much.
Thank you, sir. It was very elaborate and very good session on renal issues. Murthy, sir?
Thank you very much, Surendra sir. You have taken an excellent topic, renal failure, and I am asking all elite members, please go through this one. And next week we are taking only renal failure, acute renal failure and chronic renal failure. And all these days I have taken urinary problems also. Along with this, we will merge this renal failure and we will discuss, because the persons who have completed 55 years, generally some renal failure will be there or any urinary problems will be there. So many points we have to discuss on that topic. Next week we will see. Sir Anup Kumar sir, you can take the class.
Okay, sir. Thank you.
Okay, thank you.
Yeah. I had been trying to take this the last part of the alimentary canal for past many times, and we got postponed. So I will continue that rectum and anus this today. One second. This is again a topic which everybody will be interested in, and we all should know what is going on in that.
మీరు ఎన్ని గంటల బయలుదేరితే అడిగాడు 5 పావు గంట అడిగేట్టు వచ్చు. వర్షం పడుతుందా?
తగ్గింది వర్షం రెయిన్కోట్
ఈరోజు కార్తీక దీపం కదా, కొంచెం జనం వస్తారేమో డౌట్, రారేమో డౌట్.
Yeah, this the last part of the alimentary canal is the rectum and anus, and we will discuss the disease and homeopathic approach of how to handle the disease of rectum and anus. So normally the rectum is empty because the stools are stored in the higher descending colon. Now when you have a normal feeling normal, your rectum is empty. And the stools, what is already ready to be or evacuated, will be not in the rectum area. It will be in the descending colon, waiting for next orders. The rectum follows the shape of the sacrum and ends in an expanded section called the ampulla. There is an expanded section called ampulla. the stools or feces are held in the rectum temporarily just before they are discarded through the anal canal. So when it reaches the rectum area, you will not be able to hold so long. You will essentially you have to discard it and evacuate your belly. So this is what is the rectum area, and the sigmoid colon. Anyway, you know the picture is it will be like this. It will be like a said English alphabet said. So it's called sigmoid colon. So normally it will be here, and it will not be descending to the rectum area. Once it is reached here, then you don't have much time to hold on. It will have to be excreted or you have to discard it. So the rectum is about 12 to 16 centimeters long, and it has two flexures, the sacral and the perineal. The three rectal folds there will be the superior, middle, and inferior rectal ampulla. So this is what it is. They have three folds. You can see the three rectal folds are there, and the last and the rectal ampulla. This histologically, by scientific the cell layer studies, the rectum is similar to the rest of the part of the intestine. We have been seeing all the part of the alimentary canal, which has four layers. That is, the mucosa will be inside. Then beneath that we have submucosa. Then we have the muscular layers called muscularis, and then the outermost or the outermost that will be the which will be in the part of the inside of the abdomen will be the serosa. So that will be the same structure for this rectum and rectum also. Rectum plays an important role in the reabsorption of water. So all the whatever absorbable materials and good for the body will be absorbed by the intestines, and then it will be mostly waste which has to be removed off. But here in the rectum area, if you don't discard your feces on time, then if you keep it holding there, it becomes hard. The water will be reabsorbed from there, and some electrolytes which is to be discarded also can be absorbed by the rectum. So it plays an important role in absorbing the last moment absorption will happen here. And if you don't go to the bathroom on time, then your stools can become hard and constipation can happen. So there should be a proper time in like a defecation every day, so that when it moves from the sigmoid colon to the rectum, immediately you have to discard it. Otherwise, the stools will become hard and you will be finding it difficult to defecate. Rectum receives the fecal material from the descending colon and moves it further by peristaltic movement. The rectum walls expand when filled with feces. So the walls expand, and this stimulates the nerves. And when there is the feces or stools are filled inside the rectum, the walls expand, and this expansion stimulates the nervous receptors of the rectal wall and brings the desire to pass the feces or stool. So that is why when we normally don't feel like going to the toilet, but when the fecal material moves from the sigmoid colon to the rectum area, the rectum wall expands, and it stimulates the nerves of the nervous receptors on the rectal walls, and that will initiate the desire to pass through. So again, you can see the picture, sigmoid colon. There are three folds inside the rectum area, and once it is reached here and it is full, then we get the feeling of passing the So these are the parts of the rectum and anal area. So anus is a 2-inch long canal. The anus starts at the bottom of the rectum. So where the rectum ends, the anus starts. Anus is an opening where gastrointestinal tract ends. So this is the last part of the GI tract, gastrointestinal tract, and it exits outside the body. The anorectal line separates the anus from the rectum. There is an anorectal line that separates the anus from the this is the anorectal line. So this is the rectum, which we said we have three parts, and here this is a line called anorectal line, and that is the separation between the rectum and anus. and a tough tissue called fascia surrounds the anus and attaches it to the nearby structure. So fascia, a tissue called fascia, is attaching the anus to the body of the buttocks and surrounding parts of the muscles and all. So normally, a good healthy anus will look like this, with like a circular, proper closed opening. That is, the opening is there. It is closed by circular muscles. Normally, healthy people will have this type of anus, and others will have, when there is disease, this structure changes and it will become a problematic anus with certain flaps and certain muscular regions or certain tears and twists and all. So there are two anal sphincters, an internal and an external sphincter. Sphincters, are circular muscular structures which will be used, which normally controls the opening of our body systems. In many places we have sphincters. We are seen from the esophageal sphincter, the pyloric sphincter, the duodenal area. Everywhere we have sphincters, and that is how the movement is restricted further to that by closing the sphincters. So there are two sphincters here, and with these two sphincters in position, in place, and action, we are able to pass gas without passing the stools. So these are that there are two precautionary methods, and two anal sphincters are there. The outer ring of the muscle is the external anal sphincter, and this is a voluntary muscle. We can hold it by our willpower. The voluntary muscle, which can be tightened at will. We can tighten it at will. The outer one, especially in emergency or in diarrhea time. When diarrhea is there, or emergency to go to the toilet is there, we can hold that muscle tight so that the fecal matter will not escape from our body. So that is the external muscular anal sphincter is a muscle which we can tight by will. These sphincters and the resting contractions of the puborectalis muscles prevent the leakage of feces. So these sphincters will help us to hold the feces tight, and even the muscular rectal muscles also will help to hold the feces inside the rectum when we are not prepared to go to the defecate. So this it allows feces and gas to leave the body. So we can selectively allow the gas also slowly by opening the sphincters and allowing the gas to go. So these are the voluntary involuntary muscles which are working together to make our life easy. So anatomy of the anal canal is again here. The rectal ampulla is here, and this is the anus area, and this is the anal canal, and this sphincter muscles here. This is another. This is the external sphincter muscle, but it's a cut section, and there is internal muscle also. So this is a muscle which we can hold tight when we are in emergency. The anal canal is located within the anal triangle of the perineum between the right and the left ischio-anal fossae. It's a final segment of the gastrointestinal tract and around 4 centimeters in length. The canal begins as a continuation of the rectum and passes inferior posteriorly, that is downwards and outside, to terminate in the anus. Its function is to regulate and release the feces by two muscular sphincters, which I've already discussed now. So rectum has its own set of diseases. So this is what we have to be very careful, and disease and disorders we have to listen and remember. They include hemorrhoids. Everybody are familiar with hemorrhoids. Abscesses. There will be some boils and abscesses, deep-seated boils. That's called abscesses. Fecal incontinence, like urine incontinence, fecal incontinence. When the muscular failure is there, then we can't hold our stools. It will be a very bad, situation where we will not be able to control our stools, and it passes by itself. That is a very bad condition. And the anal area, rectum area cancers are also there. So hemorrhoids are swollen veins. So these are swollen veins, like varicose veins. Swollen veins similar to the varicose veins in that area. In our lower rectum and anus, there are varicose veins in the lower rectum and anus will be seen as hemorrhoids. Internal hemorrhoids are related to the rectum and are usually painless, but may bleed. External hemorrhoids may cause pain and related to the anus. So the parts where the hemorrhoids are seen, it is either because of the rectum area or the anal area. Hemorrhoids are also called piles. So we have two types of piles: internal piles and external piles. We'll see the picture. So if the internal area, the internal sphincter, internal area is having this varicosity, and it pops down from the top to the outside the anal opening. We feel like it is like a bunch of grapes or something. We'll see like the veins will be pushing out of the anal area, and that's called the internal prolapsed hemorrhoid. And this is the external area. When the veins in the external area near the anal area prolapses, sorry, external hemorrhoids will be seen like that. The most common causes of external hemorrhoids is repeated straining of stools. So this is the thing. So the varicose veins or the veins are there for everybody, but when you keep on continuously having constipation and you pass stools with pressure, every time you have to apply pressure to pass stools, then these veins also will get the external extra pressure and they start developing hemorrhoids. The hemorrhoids develop when the veins of the rectum or the anus become dilated and enlarged and can either be internal or external. So when you are constipated, don't apply pressure to expel the stools. You have to either use anemia or any sort of stool softness or something which will help you to have a smooth stool evacuation. If you use pressure, definitely there's a chance of getting hemorrhoids. The external hemorrhoids are usually found beneath the skin, that surrounds the anus. So you will see pictures of that also. So internal hemorrhoids will be looking like bunch of grapes hanging from inside, which will come outside the body, and it will retract back also when there is no pressure. But the external hemorrhoid will be like a bulge on the outside of the mouth of the anus. So it will be the picture we'll see. So this is how the piles or the hemorrhoids look like from outside, and the technical internal diagram is this is varicosity which is seen inside, and this is another varicosity seen at the mouth of the ulcer, mouth of the anus. So both can show this one can come out and go inside, but this will be always shown as a bulge here, and these are the piles which will be difficult for people to, it will be painful or sometimes bleeding or sometimes prevent the normal evacuation of stools, and it is painful also. Sometimes it will be burning, pricking pain also will be there. So when there is, when it is normal, it will look like that, which is not very problematic, but it will be enlarged. But when it is thrombosed, when it is blood clot is there inside, and it will be seen like this. It will be deep purplish and brown or reddish in color, and the mouth of the anus will look like painful first of all, and then it will be looking like this thrombosed hemorrhoids. So the medicines what we can discuss for that is vesiculus hypocastianum is a very good medicine. Hemorrhoids are sore and aching with swollen feeling. Pain may last for hours after passing stools. So after passing stools also, you have pain which will last for a long time. Lump-like feeling or feeling as if a lot of sharp sticks are inside the rectum. So rectum will feel like something is being kept on poking, some glass piece or bits of sticks are inside the rectum, poking them. Sharp and shooting pains in the rectum and lower back. Vesiculus hippo will definitely help you if you have such a problem. Definitely remember this. It's a very good medicine for burning piles and the pain remains for a long time after passing stools. Next is yellow. The yellow is a good medicine. Hemorrhoids that are swollen and protrude. So when the hemorrhoids will be swollen and protruding like a bunch of grapes, that is internal hemorrhoids we are discussing now here, where yellows works well there. Better by cold soaks. There are or cold compresses. There will be some cool packs, cold packs, which can be used as cold compresses, and will have diarrhea also and have lot of flatulence also when there is these sort of problems. And hemorrhoids will be swollen and protrude like a bunch of grapes. Aloes is the medicine. Please remember that. Naxomica is a common medicine for many. It's it is used for many busy man's life disorders. So anaxomica again relieves hemorrhoids that and caused by sedentary life. So this modern man is having sedentary lifestyle, and the Naxvomica helps in many ways, and it works on hemorrhoids also. Overeating and drinking also will have these sort of hemorrhoid expressions, especially by spicy and rich food and alcohol. So all those bad effects of these busy man's lifestyle, and overeating and drinking, and hemorrhoids will be formed there. Then Naxvomica will help to sort that issue out. Pulsatilla, hemorrhoids that are itchy and uncomfortable with sticking pains, and they may protrude and stand while standing and retract while lying down. So again, that is the internal hemorrhoid which will hang and outside and go back again, and it is itchy and all those things. Pulsatilla works. Symptoms worse when warm. That's why we said cold pack and cold compress will work well. So when it is warm, this will be very bad. It is very helpful remedy for hemorrhoids that appear during pregnancy and around menstrual period. So ladies with during pregnant time, they will have already a very big pressure on their abdomen and downwards. So definitely they get these sort of hemorrhoid issues also, and even on the menstrual period also, they may have some sort of this sort of piles issues, and their pulsatilla is their medicines for we work on the gynecological part and also on the hemorrhoid part also to set the things right. Sulfur, itching and sulfur are always connected. So again, here also itching, burning, oozing hemorrhoids, sulfur, accompanied by a feeling of fullness and pressure in the abdomen. So it has to be used with great care. Sulfur has to be used with a good practice and care only with an expert advice. Anus inflamed and red and may protrude significantly. So anus will be protruding and inflamed. Worse from warmth and bathing, and strong offensive flatulence will be there. So warm bathing will be a problem, and the strong offensive flatulence will be there. So sulfur is indicated remedy there. Hemamalis will be always spoken of when there is bleeding. Hemorrhoid sensitive and painful to touch and easily bleeding. So hemamalis is from easily bleeding. Improves venous circulation and relieves symptoms. So when there is this again is venous medicine and venous problem also. And if it is bleeding, hemamalis has to be thought of. So now we'll talk about the rectal anal abscess. Abscesses are deep-seated boils. There is some infection, some sort of infection, and the pus is inside that, and it has to be expelled out. An abscess is a pocket of pus. Pus is a mixture of dead and living white blood cells and germs and dead tissues. So it's a combination, it's a mixture of the dead cells, white blood corpuscles, and the dead tissues, everything together, which has to be expelled out of the body. This results in our immune system fighting the infection. So there was an infection, the WBC works on that, and the immune system controls the infection, and the pus has to be eliminated from the body. Bacteria, viruses, parasites, and solid objects can lead to abscesses. So whatever we sometimes some unwanted things we eat, that can also cause abscesses. Then viruses, bacteria, parasites, everything can create deep-seated abscesses. Skin abscesses are easy to detect, though, because you'll feel it. And deep-seated abscesses are dangerous and painful, because which is on the surface will be like small boils which we can easily find, and we can even prick it and eliminate or free the pus in that. But deep-seated abscesses are dangerous because it will not easily come out unless it is properly handled. An anal or rectal abscess occurs when the cavity on its wall becomes infected. The rectal wall will have cavities, and sometimes it can get infected because of some sort of parasites or some attack of bacteria or viruses, and it can cause extreme pain, fatigue, and rectal discharge, and even fever. When there is infection, fever will be there. Antibiotics or surgical treatment is usually done for this, but we have medicines which can handle that. In some cases, anal abscess can result in painful anal fistulas. So this infection on the wall of the rectum can extend inside to the muscles and then open outside onto the buttocks wall. So I'll show you pictures of that. that's called become anal fistulas. When abscess does not heal and the infection makes a tunnel through the tissues to the outside of the skin. So from inside the rectal wall, the opening makes a tunnel through the muscles and opens outside onto the buttock side, and that is called fistulas, which we will see the pictures. So from outside, this is the anal opening, and here you can see another small bulge. This is actually an opening, and this is connected from the rectum inside, and it's on the part of the buttocks. So this is the renal abscess, which is this is the rectal abscess, which is opening from inside and opened outside. So it is like a tunnel from here to here, and you can see how much difficulty it will be there. Even if the rectal muscles are held together to hold a gas or the fecal material will come out of these folds. So that is very nasty. Also, you can't hold your bottom will be always wet and sticky. Epasat is the best medicine for infection. Commonly used remedy for painful abscess with pus, throbbing, and sphincter-like pains. Very sensitive to slight touch. Myristica is called the doctor's knife or surgeon's knife. Hastens the separative process. It helps to promote healing and speedy recovery. So Myristica also works well on the sort of fistula and abscess situation before fistula formation. Then belladonna is best medicine in the initial stages where there is redness and swelling and hot and intense throbbing, pulsating pain will be there. Very tender to touch. So belladonna, normally hot and red, will be the indication. And Mersol, when the pus discharge is thin and green and streaked with blood, irritating and bad smell is there, Mersol is again a very good healer, and this can work well on that situation also. Pneumonia, severe itching and burning pains and discharge of offensive fluid, worse from sitting, and during and after passing stools. So this is the medicine. And arsenic album, abscess with great burning sensation, marked debility and discharge of watery pus and itchy pus, tendency to form gangrene with intolerable burning pains. So when there is infection, we have to quickly control it. Arsenic album helps it. Then nitric acid, separating abscess. So when there is pus formation, nitric acid, this discharge is offensive, excoriating, and dirty because of a mixture of everything together, and greenish and yellow in color. And calendula, normal our wound healer. The pus is thick and yellow without inflammation, and it helps in promoting great healthy granulations and healing the wounds quickly. So all these things have to be remembered, and we should be observative and should not allow the things to go out of our hands. Then the other disease is called fecal incontinence. It's a very nasty problem. It's an inability to control the bowels movements, causing stools to leak unexpectedly from the rectum. So we don't have control on the anal sphincters. They all also it's called bowel incontinence. Fecal incontinence ranges from the occasional leaking of stools while passing gas to complete loss of control. So when you pass gas, sometimes a little of stools escape. That is also a part of fecal incontinence because there is some problem in the sphincter there. It can be temporarily or little more longer lasting. It depends upon the problem. So causes of fecal incontinence: severe or long lasting constipation and diarrhea. When there is long lasting constipation or diarrhea, we will have this muscular failure. Irritable bowel syndrome can cause this. Inflammation bowel disease. Inflammatory bowel disease such as Crohn's disease will also cause this sort of problem. Severe piles where the muscles are all out of shape and control, then also they cannot do that. And childbirth or surgery damaging the muscles, nerves, and which control the rectal anal muscles. So some surgery which has been done in that area, and during childbirth also, if there is some unexpected tear and damage to the nerves there in that area, then these sort of problems can happen, and which are all very sad to feel and imagine also. So homeopathic medicines for this fecal incontinence allows sense of insecurity in the rectum when passing flatulence. So when you pass stools, you feel there is a chance of stools escaping. Then yellow is the medicine. Uncertain whether the gas or stool will come out. Anus is sore after stool. Rectum will be bleeding and will be hot. Better by cold water. Feels as if the power of the sphincter anal is lost. So we will not feel like we will feel like we cannot control the anal sphincter. So allows is the medicine. Next is podophyllum. Stool escapes while passing flatus. Stools may be offensive and green in color. Marked urgency to pass. Like we will feel continuously we have to go to the toilet. Podophyllum works. Rectal prolapse may also be present. Causticum, constipation with hard, difficult, tough and knotty stools. Causticum will be recommended there. The first part of the stools will be hard, the rest will be soft. This can happen if you store your feces also for a long time. The part what is inside the rectum area will be hard, and what is which is on the sigmoid colon will be soft. This can be temporary also. So frequent unsuccessful desire to pass stools. So here the patient wanted to pass stools and he was not able to pass stools because of this condition, and so he will postpone it, and then it becomes harder and harder again. So constant anal itching, better to apply cold water into the anus. Causticum is the medicine, and when he applies cold water to the anus, maybe he feels the itching is better. Hyoscyamus, uh, stools, incontinence during urination. While you pass urine, you will feel like stools are passing off. Sleep due to weak anal sphincter. Urination or sleep, like when you are sleeping also stools can pass off, or when you are passing urine, the stools can pass off. This is because of the weak uh, anal sphincter. Hyoscyamus helps to strengthen the anal sphincter. Then sulfur, stools, incontinence during laughing, sneezing, and passing flatulence. So when you're having this sort of problem, sulfur, anus is red and swollen and sore, marked itching and burning in the anus. China or cinchona, China, the stool incontinence with excessive flatulence and bloating. The flatus or gas is obstructed, and the person may suffer from chronic diarrhea. So chronic diarrhea, again, when we have loose motions and all, we refer China. So this works here also. The stool is frequent, thin, watery, and patient is tired and weak. So China works on all these things. Anal fistula. We will discuss anal fistula is an abdominal channel developing between the anus and the skin of the buttocks. So this is a tunnel which is formed from the anal inside the anus to the outside of the buttocks. Symptoms of the anal fistula is skin irritation around the anus, a constant throbbing pain that may be worse when sitting, and move around passing stools or cough. So this irritation will be there in that area. Smelly discharge from near the anus. Not from the anus, from near the anus there will be smelly discharge from a small hole, passing pus or blood during defecation. So when you have when you pass stools, you will have pus or blood during defecation. Swelling and redness around the anus with fever, high fever. So these are the symptoms of the anal fistula. So this again remember the rectum, and there will be ulcers there, and some ulcers will keep passing into the muscular area and open through the buttocks area like this. This is the canal, the channel or the canal developed in addition to this. So when these muscular sphincters tighten, this canal will be open and your gas or stools can pass out of your body through this part, and it will be a nasty situation. So anal fistula is happening that way. So from outside you can see it is like this, a normal anus, and you can see a white patch here. This is actually a tunnel which is connecting from inner rectum to the outside, and you can see there will be leaking liquids and pus and even stools which also can escape through this tunnel, and it will be very stinky because your clothes all will become wet and stinky. So before surgery, they have put to show us a metal wire is put from inside to and through the rectum. You can see it is like that. So normally what they do for treatment is they will cut the muscle like that. After putting a wire, they will cut this tissue, allow the condition to heal up, and then they will stitch it back or it will heal by itself. So this is how it is treated by allopathic methods or the English surgical method. This is how it is done. A wire is inserted and then it will be cut open. So our treatment is silesia. Silesia will the discharge of the pus or blood from the fistula. Rectum is paralyzed, painful, irritable sphincter running. That is, anal sphincter will be irritable and with a spasm. Stools come down with difficulty and partly expelled. Recedes again because of the pain there. Maybe it goes back again into the rectum area, and blood present in the stools like cadaver, that is a dead body like smelling, offensive diarrhea will be there. Silesia helps in treating the hard and irritated skin around the anus. So silesia is important to treat the fistular kind. Hepar relieves the immense pain due to fistula, helps to heal the highly inflamed swollen skin around the anus. So Hepar helps in clean SPLC. And Myristica, this remedy reduces the pus discharge and fully heals the fistula. So Myristica also is important. We have good medicines for that. Acts more powerfully than above said remedy. So Myristica works well, so has to be recommended. Graphitis will be used always when there is a sticky oozing from any even from the skin disorders and all those eczemas and all. Graphitis is recommended. Again, sticky oozing liquid from fistula. Graphitis is recommended. Itching around the anus. Calcarea sulf, yellow colored pus discharge from the fistula. Calcarea fluor promotes the healing of fistula. Calcarea fluor dissolves hard tissues or the walls of cyst and all. So calcarea fluor is good for this treatment of fistula. Puja prevents infections and supports quick healing. So puja also is recommended. So anal fissures. This is another thing. Fistula is different. This is anal fissure. Fissure is a tear in the lining of the anus. So because of hard stools, when the hard stools pass, small tear can happen on the anus, often caused by constipation. When you hold your stool for a long time and then forcefully expel the hard stools through the anus, this anal lining can be torn, and this can create problems. Pain, especially with bowel movements. When there is a tear and infection and again you pass stools over that, then the wound will be painful again and it will be a big problem continuously, because this tract cannot be kept closed for a long time. It's like our tarring our road when there is the highway road. No, you cannot stop the vehicle and put the tar. The same way, this is a continuous high traffic area. So when anal fissure is there, it will be a problem for the patient. Signs and symptoms for anal fissure: pain, sometimes severe during bowel movements, pain after stools, which may last for several hours, bright red blood after stools, because red blood comes because when the stool passes, it will dig again onto the same wound, and blood will be discharged from the wound again after bowel movement. Visible crack in the skin around the anus will be seen also. So this will be fissures. So this is how the fissures will look like. The anus, which is beautifully round and circular muscular opening. Now this looks torn, torn, and it is inflamed. Here, after healing, a portion of the flap is extending. Many people would have seen this. Many, almost all elderly people will have some disorder in the anus because of the constipation or anything like that, and a flap of the tissue will be hanging out of the anus, which is part of the fissure, which is healed temporarily, but we have to be careful not to get constipated. So nitric acid is the best medicine for stitching pains, tearing, burning, cutting, and stinging pains in the anus. The stool is hard and bright red bleeding from the anus after stools. The reason for bright red bleeding is hard stools are reopening the healing wound, and that is why blood is discharged, and we have to take nitric acid. Retinia is the best medicine for external application and for consuming also. Long-lasting pains in the rectum with excessive burning with after stools. Then feeling of broken glass or knife piercing the rectum, strained passage of stools, constricted anus. So like Rectania Q, mother tincture can be applied outside, and Rectania 30 can be had internally, and definitely there will be a good relief for the problem. Pioneer offensive discharge from the anus due to crack in it. The violent pain in the anus during and after passing stools. Bleeding will be there. Anus is ulcerated, fissured, irritating, itching, and burning. So this is the medicine. Hemamalis, again, when there is bleeding, anus feels sore and raw, fissures bleeding profusely with soreness, dysentery, pulsation in the rectum, hemamalis. Mangifera indica, incidentally, is a mango. Mangifera indica, all burning, painless, paining fissures, yielding it will yield to this remedy. So Mangifera indica is a very good medicine for burning fissures, prevents passive hemorrhages also. So it's a preventive also. So if somebody has a tendency to get fissures or anything in the anal area, Mangifera indica can be taken. Sulfur itching in the anus may also be accompanied by burning sensation. Sulfur and Nux vomica, constriction in the rectum, fissures, itching, and very painful after dysentery, after stools, and relieve pain for some time after stools, pain relief for some time, constant uneasiness in the rectum, in diarrhea. So other diseases of the anus we will discuss here. Anal itching. There will be anal itching for no reason. Itching around the anus is a common problem. When there is pinworms, we can see kids, children and adults also may have. When there is pinworms, there is itching. That's a different problem. But here it is not pinworms. Then it may be due to fungal growth. So sulfur is indicated here, and maybe puja or external application of puja or puja cure, all those things can be useful. Then constipation will be there. Constipation, difficulty in passing stools is common and can cause anal pain. Anal fissures, bleeding, and bleeding hemorrhoids also be caused by constipation. Bryonia, calcarea carb, causticum, raphitis, lycopodium, natrum mure, Nux vomica, sepia, etc. are good medicines. There are other medicines also, depending on the symptoms, like in alumina and all those things work well. Anal bleeding, bright red color, red blood from the anus is sometimes due to hemorrhoids, but requires evaluation to rule out more serious causes. And hemorrhoids can be given. And anal cancer, cancer in the anus is rare. Infection, infection with human papillovirus can be the cause of cancer, and it's better to approach the allopathic doctor to analyze and find the problem first, and we can then assist our treatment after that. So this is all with anus and rectum now. So I will stop our session here. Thank you, sir.
Thank you. Very beautiful presentation.
Very nice.
Yes, thank you. I wanted this to be remembered by all of us, because this is a disease which everybody may have, but will hesitate to discuss with the doctors. So that at least if we know how to handle it, we can at least help our near and dear also, and if it is for ourselves also, we can do that. This is something which cannot be avoided. By age, we have these other problems, somebody or the other.
Excellent presentation, Anu.
Thank you, sir.
Very nice, sir.
Right. So what do we do now? Any questions or anything we can? Murthy sir, you can take some questions if there is any. Any questions? I can hear many voices, but nothing is coming in the question form.
Can we have the copy of the presentation on the WhatsApp?
Yeah, we can do that. No issue. Anyway, this recording will come. We can do it. I could not see who asked.
RC Bhatnagar. RC Bhatnagar.
Okay, Rakesh Bhatnagar. Okay. I
Rakesh
can see
Bhatnagar.
many speakers on, and yeah. Okay, sir, we'll
Ah.
take this.
It's a
Yeah.
really
Thank you. We can get it.
So I think there is nothing much to discuss. We can wind up, I think, because nobody's having any questions now. What is sir, I think?
Yeah, we can wind up.
Sridhar sir?
Any doubts? Any doubts?